Now to the coronavirus, and Ohio continues to see unprecedented levels of COVID-19 hospitalizations. As of today, 1 in 3 patients in Ohio hospitals or the ICU has COVID-19, and it is making care hard to come by from the emergency department on up. Sarah Shookman is here now with our current reality. Sarah.
Yeah, Lena, the best news today was that new cases here in Cuyahoga County seem to be dropping by about 25% in the last 2 weeks. We know hospitals are a lagging indicator, so health officials predict that hospitalizations could peak sometime later this month. But until then, all our hospitals are strapped for resources. Doctors told me this today is the consequence of what they have been talking about for weeks. There are 2 issues here: space and staff. More than 1,200 National Guard members have been deployed to 40-some hospitals around the state to help with staffing. In terms of space, Cleveland Clinic says it's now purposely triaging and even treating patients in the waiting room.
If there's no room to put them up on the floors of the hospital, then they have to wait down in the emergency department. The reason that some people are being seen in the waiting room is because there's not additional rooms in the emergency department, because some of them are housing patients which are waiting to get a floor bed.
Dr. Robert Wyllie with the clinic stressed no one is being turned away from care. They're still finding that those hospitalized because of COVID are about 75% unvaccinated. One sign of hope, they say, the clinic is now seeing twice as many providers returning to work from isolation than those going out with a new COVID diagnosis. They still had about 3,000 caregivers out as of this morning. Now, we have heard several anecdotes, including a family I talked with today that waited 22 hours for care at Cleveland Clinic Akron General before simply heading home earlier this week. So I will share their story tonight at 6. Lena.
Wow, both scary and frustrating. Thanks so much, Sarah.